Imagine waking up with chest pain and not calling 911 because you don't have health insurance. That's not a nightmare, that's a reality for 27 million Americans. Every day, people gamble with their lives because they are more afraid of the bill than the heart attack. According to the US Census Bureau, nearly 8% of population, about 1 in every 12 people, are uninsured. That number doesn't even include the underinsured people with coverage so poor they avoid care because of massive deductibles and copays. Here's the truth. Without insurance, routine checkups are skipped, early signs of disease go unnoticed, and by the time care is finally sought, the illness is far advanced and far more expensive to treat. This is one reason why chronic diseases are exploding, like heart disease, diabetes, hypertension, conditions that could often be prevented or controlled if caught early. Picture Maria. She's 42-year-old, works two part-time jobs, no benefit. She has been feeling tired, thirsty all the time, losing weight without trying. She suspects diabetes but skips the doctor. 3 months later, she is in the ER with diabetic ketoacidosis, a life-threatening complication. Or think of James, a 55-year-old mechanic with no insurance. He had chest pressure for weeks but doesn't want a 5,000 ER bill. One night, he had a massive heart attack at home. These aren't just stories, they are happening in every community every single day. As a country, we have misplaced priorities. America spends more on healthcare than any other country in the world, over $4 trillion a year. That's more than $13,000 per person. Yet millions can't afford to see a doctor. Why? Because so much of that money never reaches the actual patient care. It's eaten up by insurance company profits, bloated administrative costs, hospital executive salaries, and wasteful spending. Yes, insurance companies design plans with narrow networks, high deductibles, and endless prior authorizations. They promise access to care, but in reality, they delay or deny treatments to save money. And here's the kicker: more expensive interventions later. In other words, the system profits from sickness, not from keeping people healthy. Here is the human cost. The uninsured are more likely to die from preventable causes. They are likely to receive cancer screening, vaccinations, or treatment for chronic conditions. A Harvard study found that being uninsured is associated with 45,000 preventable deaths every single year in the United States. Let that sink in. That's like a fully loaded passenger jet crashing every single day, and we just accept it. Imagine even if a fraction of that billion spent on corporate lobbying, administrative overhead, and marketing were redirected to free preventive screening, affordable medications, mental health services, community health programs, we could have healthier, happier communities. Those denials often lead to patients getting sicker, which means we could catch diseases earlier, save money, and save lives. Instead, the money flows upwards to corporate executives, shareholders, and army of lobbyists working to keep the status quo. If you are insured, this might feel like someone else's problem until you lose your job or get sick or watch a loved one struggle to pay for the care. The uninsured crisis isn't just about statistics, it's about neighbors, friends, parents, children. It's about whether we value health as a right or privilege for those who can afford it. We can't change what we don't talk about, and we can't fix what we don't understand. So the next time you see the headlines about record profits for insurance companies, remember the Maria and James of this country and ask yourself, who is the healthcare really for?